Perimenopause is a time when you have very high FSH and also high estrogen.
Yeah. Low progesterone.
These two are there. Okay. So the real issue and the cycles are very erratic. And inside also the hormones are the climacteric, what you say, like you cannot even make out from outside, even from a lab. So if LH is okay or LH is going up, estrogen is very high, FSH is quite high, or LH is normal, I should say, that is the time when accidental pregnancy chances are very high. Perimenopause is the time when a patient can ovulate at any point of time, in any of the cycle. Very, very difficult to know which cycle. Because FSH is good and the follicles are very much responsive to the estrogen at that point of time, or FSH. So ovulation happens and the accidental pregnancies happen in this phase of perimenopause. So it becomes a very crucial question of what HRT should be given at this point of time. Now the here purpose are two. One is the contraception has to be taken care of. AMH goes slow. Yeah, but AMH again itself is not a diagnostic thing. And in perimenopause it's a confusion. In menopause it is going to go very low, but perimenopause you are again in a dicey situation. So in that scenario, what we do is, what should be done? Give the OC pill, a low dose OC pill, something like placenta. This OC pill will work two things. One is those highs and lows of hormones or the erratic release of hormones will be taken care of because they will be suppressing LH and FSH. Climacteric is taken care of. Second is the ovulation part. So OC pill will be anti-ovulatory, so pregnancy risk is not there. Third is the cycles will be regularized for whatever time. Done. So for about 6 to 8 months or 9 months, a patient can be simply put on OC pill. So that problem is solved. After that time, now the question is, we have started OC pill, now what to do? Shall we continue the OC pill lifelong, or we have to when to shift from OC pill to the transderm or to the HRT? And HRT has got no contraceptive efficacy because of the low dose. So by 6th to 9th month, you can plan to withdraw the OC pill. Tell the patient to follow some contraception for next 2 to 3 months. And as soon as the patient gets amenorrhea for 3 months without pregnancy, that is the time you can tell the patient to go on HRT. The simple. And in the initial phase of HRT also, the patient should follow some contraception, maybe the male partner, because HRT is not going to prevent against contraception. And after 6 to 9 months of this HRT, then things are done. So this is the pathway from perimenopause to menopause. But if a patient is coming early menopause to you, already 12 months of amenorrhea is there, more than 12 months, menopause is done, LH is very high, FSH is very high, estrogen very low, progesterone is very low. In that scenario, you don't have to go for OC pill. You can directly go on the